Welcome to our Explainer series. As you know, the government has opened up its second phase of vaccination. Anyone above the age of 60 or above the age of 45 with comorbidities now qualifies to get vaccinated against COVID-19. We've had a bunch of questions come in from people who are particularly worried about getting the vaccination for their parents. So we've tried to answer as many of those questions as we can on this explainer. So I hope you find this information useful. Do share it with anybody else you feel might be able to use this information while they are navigating this process. So remember, the vaccination is now available in public hospitals, in government hospitals and in private hospitals. In private hospitals, you'll have to pay 250 rupees per dose, and it's a 2-dose vaccination, so that's 500 rupees altogether. But whether you're getting a public hospital or a private hospital vaccination, you have to get registered on the CoWIN portal. Now here's the thing, it is a website, it is not an app. A lot of people spent a lot of time looking for an app which they couldn't find, but it's not an app. The government has clarified on this tweet by the Health Ministry that it is in fact a website. It is www.cowin.gov.in. www.cowin.gov.in. That's the website you should be going on to. And when you get onto that website, the first thing that you'll see is your registration tab that will then ask you to feed in your mobile number. You can actually register yourself and your parents, which is a good thing because a lot of senior citizens might find this process a little cumbersome and annoying. So once you actually key in your registration number, it will give you an OTP as an SMS sent to your mobile phone. Again, some people in the beginning had trouble with the OTP, but we're expecting that to be sorted out over the next few days. Once you key in the OTP, it will take you to the registration page where you have to put in some of your details, including the year of your birth, gender, and also it will ask you for ID proof and ID number. Now remember, this is the government ID that you need to carry when you go to the center to get your vaccination as well. According to reports, those in the 45 to 60 age group will have to either upload medical certificates after picking from a drop down of which ailments they're facing, or they'll have to carry those physical certificates to the center when they're getting vaccinated as well. So if you're 45 to 60 and you have comorbidities, then you will either ways need to keep hard copies of the ailment with you. Then it will ask you in the next page if you want to add anybody else. So you can add another person if you want to. Then you get to actually blocking your slot. So you key in your details of where you live, state, city, pin code, and it will give you a list of the centers that are closest to you. You can pick one out of that and then block a date and block a time. Also, people have had some issues, A, with the OTP, and B, not finding centers close to them. We're hoping that the committee and the government that's in charge of this will actually sort these problems out over the next few days, because they seem to be responding to what people are saying on Twitter and other social media quite carefully. Well, now to the part of the conversation that answers the other questions. What do you do if you have blood pressure or using blood thinners? Will that interfere with the vaccine in any way? Can you actually choose the vaccine? How do you navigate that process? I had a conversation with Dr. Professor Srinath Reddy. He's quite brilliant. He used to be the head of the cardiology department at AIIMS in Delhi. He now heads the Public Health Foundation of India. He's dedicated his life to public health, and he's also the adjunct professor of epidemiology at Harvard. So he's really the best person to have this conversation with, and the full conversation is uploaded on the YouTube page. If you do have the time, you must take a look at it. It's a very useful conversation. But here are the shorter answers based on what Dr. Reddy told us. First of all, the question of safety. If you have health conditions, is it safe? Now, if you have blood pressure or diabetes, these conditions need to be under control, which is managed basically before you take the vaccine in order so the vaccine can have full effect on your body. It doesn't mean that you will have any specific side effects because of what you have. If you have an infection, which is a bad cold or a cough or a chest infection, it's best to get that cleared, or a UTI, it's best to get that cleared before you get the vaccine, so that your body can focus on on actually creating an immune response to the vaccine rather than fighting the cold that you have. Again, the best way to do both of these things is to speak to your physician and have the physician write a note for you. There was a big question, a lot of people ask questions about blood thinners or anticoagulants, whether that's aspirin or anything more serious than that. Now, according to the doctor, the best thing to do here as well is to speak to your physician, whoever's treating you under normal circumstances, have them check you out and have them write a note and carry that note with you to the center before you get your vaccination, so that those who are giving you the vaccination know what you're already facing. For parents or elderly people who are extremely frail and unable to travel to the hospital to get the vaccination, a lot of people asked, will it be possible for the healthcare workers to come home to give the vaccination? But as of now, there doesn't seem to be any plans for home visits for the vaccination. We've not heard of anything so far. Again, Dr. Reddy recommends that since frailty has been a challenge, it makes most sense if someone frail is getting the vaccination that they get it in a hospital where they can be monitored for any sort of side effects. Now that brings us to the side effects. These are the side effects that can be expected so far. Pain at the site of the injection where you're going to get the injection, swelling that will subside ideally in a day or maybe 2 days, muscle pain, fever again for a day or so, and headaches, but nothing particularly serious has been noted so far. Again, Dr. Reddy reiterated that the vaccines are safe. You will not get any serious sort of ailment from taking the vaccine. So someone who has issues right now with health is better served getting the vaccine, because if they were to get the virus instead, it could be very dangerous. So also the other thing to remember is, of course, that even after getting dose 1, for the first 14 to 20 days, you are still vulnerable to perhaps picking up the virus. So you need to be careful. Even after you've gotten the first dose, sanitize, wear your mask, social distancing until you get the second dose. That's when you know that you're really safe. The other question that came up is the question of the 2 choices of vaccinations. Remember, there are 2 options right now in India. There's Covishield from the Serum Institute and from Oxford and AstraZeneca. It's come out of Pune. The other one is Covaxin, that's coming out of Bharat Biotech in Hyderabad. These are the 2 options available in the market. Now, from what we've heard, it's likely that any one given hospital will only have 1 option of that vaccine, because that is what they've ordered and that's what's been shipped to them. Now, what Dr. Reddy has told us is that if you have a preference based on your own research and conclusions of which of these 2 you actually want, it might make sense to call ahead and ask the hospital what vaccine they're actually providing, or which of these 2 options they're actually providing, and then decide which one you want, because when you go to the center after making your booking, you are not going to be given a choice at that point. You will just have to opt out. So it does make sense to make those calls beforehand to try and find out which of the 2 vaccines the hospital has actually stocked, and decide for yourself if that is the one you actually do want to take. All right, we hope this is helpful, and of course, if you have more questions, leave it in the comment section and send it to us, and we'll try and get you more answers as we continue to have conversations with experts and doctors about the vaccination process. So for now, thanks for watching.